I'm not convinced that there is any significant difference between the role of an NHS board, be it a foundation trust or an NHS trust, and any other commercial organisation. The role of the board is incredibly clear. In the Corporate Code of Responsibility for Directors, it sets out very clearly that the board as a whole is accountable for the achievement of the stated purpose of the organisation and the optimum deployment of resources to achieve that. And in the question, in the case of a health system organisation, that's got to be about the efficiency with which resources are used, the effectiveness with which they're used to achieve the optimum outcomes in healthcare, and equally importantly is the quality and safety and experience that patients have, and carers and relatives, and the whole community has, of is this organisation one in which we can trust to make the best value out of public resources to achieve what the community needs it to achieve and deserves. And so the board is absolutely, every board member is absolutely on the hook for delivering that. And CQC, Monitor, all of the external regulators are there to support and enable that to happen and to provide independent assurance that it is happening. And one of the challenges at the moment is that far too many people expect these external organisations to do that job, take it away from the board, and if you look at what happened in Mid-Staffordshire, then the board abdicated its responsibility to these other organisations. I've worked with a number of boards that are in the middle of of performance, and they very often have a board meeting at which there is an empty chair in which sits Monitor or CQC or one of the regulators, that they actually look to that empty chair representing that figurehead to do their job for them. And I'm really anxious that this regime is all about encouraging and helping the boards, because if the board does not understand what's happening all the way through the organisation, if they don't provide the inspiration and the leadership and the passion to succeed, all of that comes from the board. They can't do anything by way of delivering care on their own, but what they can do is make it impossible or make it incredibly easy for the frontline staff to do the right things. And their job has to be to make it easy and to take away the barriers and to provide the inspiration and to reward success and to train. All of those things are part of the board's total accountability. Yeah, one of the things that's come through my research on leadership for the future needs of organisations is that boards have got to be courageous, they've got to be curious. And the question of curiosity is, are they asking the right questions? Are they willing to partner with anyone that's got something to offer them? Are they bringing in external auditors? Are they working with clinical groups? What sources of information are they using to triangulate their own intelligence about their organisation? And I think a board, individual directors that welcome and embrace the opportunity that this presents is fantastic. I think organisations that see this as an external imposition that's adding a bureaucratic nightmare to them for a period of 2 weeks or whatever it is, I think you've got to question, is that, you know, are those particular boards actually open to learning and open to their own improvement? I think what's really important is that although the book stops with the board for the way it enables the organisation inspires and everything else, what's really critical is that they don't do that in isolation. It is their responsibility, they can't duck it, and they mustn't duck it. But their responsibility means they have got to reach out to the community, they've got to work with other partners, they've got to listen to patients. There's a good organisation embraces and welcomes complaints and will have a high number of complaints. The question is not what are the complaints about, but how is the board using those to learn and continuously improve. And so even though the board is the key place to make those decisions have to be taken in proper consultation with the community that they are serving. They're there as public servants for that community.